Neuromuscular exercise for desk-bound employees. Warm-up starts with stretching the muscles which are tight due to sitting for long hours while working. First, let's start with neck muscles. Hyoid stretch. Extend your neck backward gently and close your jaw to feel a stretch at the top of your throat. Keep your tongue on the roof of your mouth. Hold the stretch and relax. Stop the exercise immediately if you get any dizziness or blurred vision. Anterior scalene stretch. Hook your fingers above your collarbone and gently rotate your neck to the same side. Then extend your neck backwards. You should feel the stretch at the front of your neck under your fingers. This stretches the anterior scalene muscle. Relax. Next, mid-scalenus sternocleidomastoid stretch. Hook your fingers above your collarbone and gently side bend your neck to the opposite side. Hold the stretch. You should feel the stretch at the front side of your neck. This exercise will help improve mobility to your neck. Relax. Next, posterior scalene stretch. Place your fingers in the webbing of your neck, just above the collarbone, and rotate your neck to the opposite side and tuck your chin down. You will feel the stretch under your fingers at the side of the neck. Hold the stretch and relax. Next, suboccipital stretch. Sit down with good posture. Tuck your chin down slightly and hold your fingers under your scalp. Try to elongate your neck and pull your skull upward with your fingers. You should feel a gentle stretch at the top of your neck under your fingers.
Okay.
Stop immediately if you get any dizziness. Hold the stretch and relax. Next, levator scapulae stretch. Bend your neck forwards and then side bend your neck by taking your left ear towards your left shoulder. Hold on to a chair to make the stretch stronger. This will allow you to feel a stretch at the back and side of your neck. You can make the stretch stronger by assisting with your hand. Hold the stretch and relax.
Next, upper trapezius stretch.
Bend your neck forward and then side bend your neck to the opposite side which needed to be stretched and rotate to the side to being stretched. Hold on to the chair to make the stretch stronger. You can make the stretch stronger by assisting with your hand. Relax. Pectoral muscle stretch. Bend your elbow 90 degrees and rest your forearm against a door frame or wall with your fingers pointing towards the ceiling. Lean forwards, creating a stretch across your upper arm, front shoulder and slightly in your chest. This exercise stretches the pectoral muscle. Relax. Triceps and latissimus dorsi stretch. Lift your arm above your head and try to pull your arm back down while putting resistance to the elbow. Your arm should not move. Side bend your body away from your arm to create a stretch just behind your armpit. This exercise stretches your triceps and latissimus dorsi muscle. Relax. Seated biceps and brachialis stretch. Being seated on the floor, straightening both your arms, place your hands on the floor behind your back. Slightly more than hip width apart with your fingers pointing straight behind you. Slowly bend your waist forward, keeping your weight evenly distributed between your arms. Hold the stretch. This exercise stretches both the biceps and the brachialis, and you should feel the stretch into your elbows. Relax. Stretch both hands. Place your hands on a table with fingers pointing towards you and straighten your arms. This exercise helps stretch the forearm flexor muscles and can help with repetitive strain injuries to the wrist and elbow as well as golfer's elbow. Relax. Wrist flexion passive. Use your hand to bend your own wrist. Make sure you keep your wrist relaxed. This is a passive exercise used to improve the mobility of the wrist and stretch the forearm muscles. Relax. Wrist extension passive. Use your hand to extend your own wrist. Make sure you keep your wrist relaxed. This is a passive exercise used to improve the mobility of your wrist and to stretch the forearm muscles. Relax. Radial deviation passive. Hold your arm in front of you with your thumb facing up. Use your hand to move your wrist to the side in the direction of your thumb. Make sure you keep your wrist relaxed. This exercise will help improve the mobility of your wrist. Relax. Ulnar deviation passive. Hold your arm in front of you with your thumb facing up. Use your hand to move your wrist to the side in the direction of your little finger. Make sure you keep your wrist relaxed. This exercise will help improve the mobility of your wrist. Relax. Hamstring stretch. Standing up, place your foot on a chair or Swiss ball. Keep your legs straight. You should feel a stretch behind your knee and into the back of your thigh. To make the stretch stronger, bend forward. This exercise will stretch your hamstring muscle group. Relax. Hip flexor and quad stretch. Stand up with good posture and bend your knee so your foot goes towards your butt. Extend your hip behind you to create a stretch to the front and top of your thigh. You may need to hold onto a table for support. This exercise will help to stretch your hip flexor and quadriceps muscle group. Relax. Lumbar stretch. Sit on a table with your leg straight and wider. Bend forward by keeping your hand straight. This stretches your back muscles. Relax. Place your hands together as if you were praying and push towards each other. Hold the pressure and then relax. This is a good shoulder strengthening exercise. Sitting stabilization. Sitting on a bench, rest both hands on the bench, supporting your body slightly. Gently lean on one side, putting gently but increasing weight through one arm and shoulder and repeat to the other side. This exercise will improve the stability of the small muscles around your shoulder. 2-point kneeling horizontal. Adopt a 4-point position on your hands and knees. Maintain good posture. Lift one arm in front of you and your opposite leg behind you. This exercise strengthens the deep core muscles. Relax. Scapular setting. To set your shoulder blades, imagine you are wearing a V-neck t-shirt back to front. Now pull your shoulder blades downwards and inwards as shown in the video. And hold this position. Keep your chin up and maintain good posture. Relax. Standing lower trapezius strengthening. Stand up tall with good posture. Place your arms at 45 degrees to your side and palms facing forward. Squeeze your shoulder blades together as you draw your arms back. You should feel the tightening of the muscle at the bottom of your shoulder blades. This exercise will strengthen your lower trapezius muscle and rhomboid muscles and help with posture. Standing rhomboid strengthening. Stand up tall with good posture. Place your arms at 19 degrees to your side and palms facing downwards. Squeeze your shoulder blades together as you draw your arms back. You should feel a tightening of your muscles at the bottom of your shoulder blades. This exercise will strengthen your lower trapezius and rhomboid muscles and help with posture. Relax. Standing scapular strengthening. Stand up tall with good posture. Place your arm just out from your side and palm facing forward. Squeeze your shoulder blades together as you draw your arms back. Let your chest and ribcage expand. You should feel a tightening of the muscle at the bottom of your shoulder blades. This exercise will strengthen your lower trapezius muscles and rhomboid muscles and with the posture. Wall press up. Position yourself in a press up position with your arms straight and palms flat on the wall. Drop your chest towards the wall by bending your elbows. Hold this position for 1 to 2 seconds. Return to the start position. This is a chest, back and shoulder strengthening exercise.
Shoulder stability exercises. Start with all four position on your hands and knees. Move forward and backwards and sidewards. This stabilizes your shoulder muscles.
Swiss ball sitting. Sit on a Swiss ball with good upright posture. Make sure your head is not dropping forward. Keep your eyes on the horizontal line and maintain gentle backward curve in your lower back. Sitting on a Swiss ball is great for posture and core control. Pelvic tilt, pelvic duck sitting. Sit down with good posture. Draw your belly down button inward and tilt your pelvis backwards. Return to the starting position. This exercise strengthens the deep abdominal muscles and improves your core control. Pelvic tilt or pelvic tuck lying. Lie flat on your back and engage your deep core muscles by drawing your belly button inwards. While flattening your spine against the floor, then relax. Repeat as required. Supine bridge basic. Lie flat on your back with your knees bent. Squeeze your bottom muscles and lift your body upward. Keep your arms by your side and use them to help your balance. Make sure you maintain good posture and contract the deep abdominal muscles by squeezing your tummy towards your spine. This exercise helps to strengthen the abdominal, lower back, gluteal and hamstring muscles. Bolster thoracic extension vertical. Place a bolster under your spine and lie flat on your back with your knees bent. To make the exercise harder, you can drop your neck to the floor. This exercise can help to improve mobility to the spine and your posture. Neutral position lumbar decompression Swiss ball. Lie flat on your back with your feet resting on a Swiss ball. Relax in this position. You can place your arms above your head if you wish. This exercise is a decompression exercise for the spine, especially useful for lumbar disc problems. Back extension general. Lie on your front and rest on your forearms. Your back will be gently arched. Hold this position. Start gently with this exercise as it can cause some stiffness when you first begin. Anterior stabilization with towel. Lie flat on your back with your body in a neutral position. Place a towel under your neck. Feel your neck muscles by placing your fingers just under your jaw. And use these muscles to gently tuck your chin while elongating your neck to create a gentle resistance. Try not to use any other muscles except those under your jaw and on the front of your neck. Relax. Upper cervical stabilization. Lie flat with a 4-inch diameter towel under your neck. Tuck your chin down to your chest gently while elongating your neck. Try to breathe normally and stay relaxed. The movement and resistance is gentle, so don't do it too hard. Posterior cervical stabilization prone. Lie on your front with your head 2 to 3 cm above the floor. Make sure your chin is tilted slightly so your face is horizontal with your body. You should feel the back of your neck tensing slightly to hold your head up, while all your other muscles remain relaxed. Breathe normally. Deep neck extensor stabilization. Go onto all fours on your hands and knees. Tuck your chin towards your chest slightly and maintain your chin in this position. Gently extend your neck. You will feel a stretch at the front and maybe the back of your neck. Breathe normally. This exercise will strengthen the deep neck extensor muscles. Anterior stabilization sitting with towel. Sit on a chair or the floor and against the wall with a towel under the base of your neck. Feel your front neck muscles by placing your fingers just under your jaw. And use this muscle to gently tuck your chin while elongating your neck. Try not to use any other muscle except those under your jaw and on the front of your neck. Relax. Upper cervical stabilization sitting. Sit upright with good posture and place your fingers behind your head with your thumb on your cheekbones. Apply gentle resistance to tuck your chin slightly while elongating your neck. Your head stays perfectly still while you apply the resistance, which should be gentle. Posterior cervical stabilization sitting. Sit on a chair with your back and neck reclined. Gentle tuck your chin slightly down while elongating your neck. It is a subtle movement. You should feel a gentle pull at the back of your neck. Relax and repeat as you require.
Pulling down exercises. Ankle pump. Move your ankle up and down. This will pump the blood to your heart and make you active.